You wake up with a throbbing tooth. Not just a little sensitive, we're talking the kind of pain that makes you want to rip your own jaw off. You drive to the dentist, get some numbing gel, maybe a prescription for antibiotics, and by tomorrow you're eating solid food again. Now strip all of that away. No dentist, no antibiotics, no painkillers stronger than whatever you can find growing near the river. That infected tooth? In the ancient world, that was potentially a death sentence. The infection could spread to your jaw, then your bloodstream, and within days you'd be gone. And yet, humans didn't go extinct from toothaches. They didn't collapse as a species every time someone broke a leg or caught a fever. For the vast majority of human history, stretching back hundreds of thousands of years before anyone had the faintest clue what a bacterium was, people got sick, got hurt, and somehow kept going. So what was actually happening? How did our ancestors pull off survival without a single pharmacy, hospital, or medical school anywhere on the planet? The answer is stranger, smarter, and more fascinating than most people expect. Let's start by throwing out the image of ancient humans as helpless. That framing is completely wrong. These were not confused people stumbling around hoping for the best. They were extraordinarily sharp observers living in a world where failing to notice things got you killed fast. When your survival depends entirely on reading your environment correctly, you develop a level of attention to detail that most of us have completely lost. Think about what that actually means in practice. You're living in a small community of maybe 30 to 50 people. There are no distractions, no screens, no noise, no information overload. Your entire mental bandwidth is devoted to understanding the world immediately around you. Which plants grow where, which animals behave how, what the weather is doing, and critically, what happens to people when they eat certain things, touch certain things, or treat wounds in certain ways. That kind of sustained, multi-generational observation over thousands of years produces something genuinely powerful. Not written knowledge, not peer-reviewed studies, but something arguably just as durable: tradition. The accumulated wisdom of everyone who came before you, passed down through story, ritual, and direct teaching. Your grandmother knew which leaf to press against a cut because her grandmother showed her, and her grandmother learned it from watching what worked and what didn't across an entire lifetime of treating injuries. That chain of knowledge stretches back further than we can fully trace. And the results were not nothing. They were actually remarkable. Plants are where ancient medicine gets really interesting, and this is where the science gets legitimately surprising. We're not talking about superstition here. We're talking about real chemistry that modern researchers have gone back and confirmed over and over again. Take willow bark. Ancient Egyptians used it for pain and fever. So did ancient Greeks. So did indigenous peoples across North America. These cultures had zero contact with each other, and yet they all independently arrived at the same conclusion. Chew this bark, pain decreases. The reason is that willow bark contains salicin, which your body converts into salicylic acid, which is chemically almost identical to aspirin. They didn't know any of that. They just knew it worked. Garlic shows up in ancient Egyptian medical texts as a treatment for infection. Modern microbiology has confirmed that allicin, the compound in garlic, genuinely kills certain bacteria. Turmeric, used for thousands of years in South Asian medicine, contains curcumin, which has real documented anti-inflammatory effects. Opium poppies were being used for pain management in ancient Mesopotamia around 3400 BCE. The active compounds in those poppies are still the basis for some of the strongest painkillers we have today. This is not coincidence. This is humanity running the longest clinical trial in history, with billions of participants and thousands of years of data collection. The methodology was chaotic, and the failure rate was brutal, but the hits were real. What's even more impressive is how sophisticated the preparation methods became. Ancient healers weren't just randomly chewing plants. They knew to boil some and not others. They knew certain roots needed to be dried first. They combined ingredients in specific ratios and documented what happened. Some ancient herbal formulations involved 20 or 30 different components, each serving a distinct purpose. The Ebers Papyrus, an Egyptian medical document from around 1550 BCE, describes over 700 remedies. 700. It includes treatments for everything from intestinal parasites to skin conditions to eye infections, written out in a format that is recognizably clinical. If you have this symptom, use this preparation, administered in this way, at this time. That's a prescription. It's written in a dead language on a crumbling piece of papyrus, but structurally it is a prescription. Now let's talk about wounds, because wounds were everywhere in the ancient world, and a bad one could kill you faster than almost anything else. The ancient Egyptians packed wounds with honey, and this was genuinely smart. Honey is naturally antibacterial. Its low moisture content, acidic pH, and slow release of hydrogen peroxide create an environment where bacteria simply cannot thrive. Modern medicine has actually come back around to this. There is a clinically approved honey product used in wound care today. The Egyptians figured this out 4,000 years ago by watching what happened to wounds treated with honey versus wounds that weren't. Other cultures used clay poultices. Certain mineral-rich clays, particularly those containing montmorillonite, have real antimicrobial properties. Indigenous cultures across multiple continents independently discovered this. Again, not magic. Chemistry. And then there's the one that makes modern audiences squirm. Maggots. Multiple ancient cultures, including indigenous Australians and Maya people in Central America, applied fly larvae to infected wounds. Before you close the tab, here's what's actually happening. Maggots only consume dead and infected tissue. They leave healthy tissue completely alone. They physically clean a wound in a way that is extraordinarily precise. Maggot therapy is not ancient history. It is currently used in modern hospitals for wounds that resist antibiotic treatment. The ancient practitioners who discovered this weren't being disgusting. They were being observant. They noticed that wounds with maggots sometimes healed better, and they filed that information away. Spider webs were applied to wounds across ancient Greek, Celtic, and Native American cultures to stop bleeding. Spider silk contains vitamin K, which plays a role in blood clotting. Researchers today are actively studying spider silk as a biomaterial for wound closure. Every time you look closely at something ancient people did, there's a real mechanism underneath it. But here's where things get truly wild. We have archaeological evidence of actual surgery happening thousands of years ago. Not symbolic surgery, not ceremonial cutting. Real, functional, life-saving surgery. Trepanation is the practice of drilling or scraping a hole into the skull, and we have evidence of it going back over 9,000 years. That's not the wild part. The wild part is that patients survived. We know this because the bones show healing around the holes. The skull grew back around the opening, which means the patient lived long enough afterward for bone regrowth to occur. Some skulls show multiple trepanation sites, meaning the same person went through this procedure more than once and walked away each time. Think about what that requires. You need someone who understands the procedure. You need tools capable of cutting through bone. You need some method of managing pain and preventing infection during recovery. You need a community willing to care for someone through a long, vulnerable healing process. That is a functioning medical system, crude by our standards, but functional. We also have a skeleton from France dated to around 7,000 years ago showing a forearm amputation with clear evidence of bone regrowth at the stump. That person survived the surgery, survived the recovery, and lived long enough afterward for their skeleton to show it. That's not luck, that's organized medical care. Here's a comparison that puts this in perspective. Antiseptic surgical practice only became standard in the 1860s, when Joseph Lister connected the dots between contamination and infection. Before that, hospitals in the 1840s had mortality rates that were sometimes worse than battlefield surgery, because the conditions inside hospitals were so contaminated. Surgeons would go directly from performing autopsies to delivering babies without washing their hands, and then wonder why so many mothers died. Ancient surgeons working outdoors in open air with clean stone tools may have accidentally had better sterility than a 19th century European hospital. The universe is deeply ironic. Beyond the external treatments, ancient humans had something working for them from the inside that we consistently underestimate. Their immune systems were extraordinary. The human immune system is not static. It learns, it adapts, it responds to what it encounters. Ancient humans were exposed to an enormous diversity of pathogens from birth, constantly, throughout their lives. The children who survived that gauntlet, and many did not, emerged with immune systems that had been battle-tested in ways that modern immune systems simply are not. There's also the gut microbiome to consider. Modern research keeps circling back to the same conclusion. The trillions of bacteria living in your intestines are central to immune function, mental health, and overall physical well-being. And ancient humans, based on what we understand about their diet and lifestyle, almost certainly had a microbiome that would make modern researchers jealous. They ate wildly diverse diets, dozens of different plant species, seasonal fruits, roots, nuts, seeds, animal products, and fermented foods. Every traditional culture on Earth developed fermented foods independently, not just because they taste good, but because fermentation preserved food before refrigeration existed. Fermentation also happens to load food with beneficial bacteria. Kimchi, kefir, sauerkraut, injera, kvass, fermented fish, fermented grains. Every culture had versions of these, and every version was essentially a probiotic supplement that would cost $40 at a health food store today. Studies comparing gut microbiomes of modern hunter-gatherer populations to industrialized populations find dramatic differences. The hunter-gatherers consistently show higher microbial diversity, and that diversity correlates with stronger immune function, lower rates of autoimmune disease, and better metabolic health. Ancient humans were not clean by our standards. They were regularly covered in soil, exposed to animals, drinking from natural water sources. And that constant microbial exposure was, in specific immunological terms, probably beneficial. There's also something else that gets overlooked in these conversations: the psychological dimension of ancient healing. This sounds like the part where we dismiss shamans and ritual as primitive nonsense. Stay with me, because the science here is genuinely interesting. The placebo effect is real, and it is powerful. Documented, measurable, reproducible. When people believe they are receiving effective treatment, their bodies respond in ways that are physiologically significant. Pain perception decreases, immune activity shifts, recovery improves. This works even when patients are told they're receiving a placebo. The expectation of healing produces actual healing responses in the body. Ancient healers, whether you call them shamans, medicine women, witch doctors, or healers, understood this intuitively. Not in those terms, but they understood that the ritual surrounding treatment mattered. The confidence of the healer mattered. The visible participation of the community mattered. When an entire community gathered around a sick person, performing elaborate ceremony, the sick person received a powerful neurological signal. You are not alone. Something is being done. People are fighting for you. That signal has real physiological consequences. Cortisol drops. Immune activity shifts. The body moves out of pure stress response and into something more conducive to recovery. Ancient healers stumbled onto this through the same observation and tradition that gave them willow bark and honey. They noticed that patients treated with ceremony and community support did better than patients left alone. They didn't know why, but they were right. Now, fairness requires acknowledging what ancient medicine could not do. Bacterial infections that crossed certain thresholds were death sentences. Appendicitis killed people we now save with a routine surgery. Childbirth was genuinely dangerous. Dental infections spread and became fatal. The numbers are sobering. Between a quarter and half of children in many ancient populations died before reaching adulthood. Those childhood death rates dragged the famous ancient life expectancy averages down to 30 or 35 years, which sounds horrifying. But that number is misleading. If you survive childhood, you could realistically live into your 50s, 60s, or even 70s. We have archaeological evidence of ancient people living for decades with severe arthritis, healed fractures, and significant chronic injuries. Old age existed, it just wasn't guaranteed. The diseases that killed people in the ancient world still kill people today, in places without access to modern medicine. Malaria, tuberculosis, cholera, diarrheal infections in children. These aren't historical curiosities. They are ongoing realities for hundreds of millions of people who lack what you probably have within a few miles of where you're sitting right now. Modern medicine is one of the most significant things humans have ever built. The fact that a bacterial infection that would have killed someone in 1850 is now handled by a 5-day course of pills costing almost nothing is genuinely extraordinary. We have simply stopped noticing how extraordinary it is. But ancient humans weren't helpless before it existed. They had real plant-based pharmacology backed by real chemistry. They had wound care that worked. They had immune systems hardened by lifetimes of exposure. They had fermented foods feeding gut bacteria that modern science is only now beginning to appreciate. They had healers who understood the psychological architecture of recovery. And they had something that doesn't show up in any medical textbook: the accumulated wisdom of every generation that came before them, passed down through an unbroken chain of careful observation and survival. They didn't survive despite lacking modern medicine. They survived by building, over hundreds of thousands of years, the most extensive empirical knowledge base in human history. We just eventually learned to write it down, put it in labs, and figure out exactly why it worked. The next time you swallow an aspirin, remember that someone was chewing willow bark for the same headache 9,000 years ago. They didn't know the chemistry, but they knew it worked, and that knowledge eventually became yours.